Hi everybody, it's Dr. Cole. A lot of people ask me, how are you different than my primary care physician? How are you different than my endocrinologist? Well, I'm making this video to go over just that. Well, to start with, how are we different? We really have to cover how chronic disease is treated in the standard model of care. Well, what do I mean by chronic disease? I'm talking about conditions such as allergic or digestive, hormonal, metabolic, neurologic issues, those conditions. Those conditions are all, no matter what they're labeled as, all treated basically the same in the standard model of care. So what happens? You go to your doctor, there normally is a routine blood test that's done, and you're labeled with a disease at that point. From that point on, you are labeled with whatever disease you may have. And at that point, let's say you're diabetic, you're 250.00, or let's say you have fatigue of some sort, so you're 780.79. At that point, you're in the system. You're treated the same as everybody else that's in your little box. So everybody gets the same treatment, and everybody has the same results from those treatments, which is basically a dismal failure. But anyways, back to my example. The training and the tools in the standard model of care is to diagnose a disease and match that disease with the corresponding drug. Now, we have 125 million, it's estimated, Americans that have some sort of chronic disease. That means, statistically, we have 125 million Americans that are being failed dismally. The management and treatment of chronic disease in the United States, as far as the standard model of care, is a dismal failure. So that's the main background that I'm dealing with as far as giving people the antithesis of what they are seeing in this standard model of care. One way that we do that is really dealing with the diagnosis part of it, looking beyond the superficial level of things, beyond the routine tests that are done, the routine labs that are done. We're looking beyond the surface, to use the iceberg analogy, where the 80% of the mass of the iceberg is underneath the ocean. 80% of the physiology is beyond the routine labs of the patients, of the labs that are done. So one way that we do it, and I'm going to show just some of the labs that we do in the office that makes what we do differently. In functional medicine, in this form of healthcare that we do, we look at all the different factors that make you you. So it's not a one-size-fits-all treatment plan for anybody. We realize everybody is designed differently. Everybody is made up differently, genetically and physiologically and metabolically. All these different factors are all customized down to that patient's individual makeup. So let's look at one of the labs. This is a saliva panel that we do. These are the best labs in the country, unique labs that really give us a clue as to what's going on with the patient. So, I mean, the lab doesn't look like much, but we use these vials to really, we send these out to a lab in Seattle, Washington, to really give us a huge amount of information that's going otherwise unlooked at. So we're looking at things such as food intolerance, things like adrenal stress index and brain function and male and female sex hormones. All of these issues that are going, again, unaddressed, widely going unaddressed in the standard model of care are being looked at here and allowing us to, again, using the word over and over again, customizing a treatment plan to really be tailored to that patient's individual makeup. And then this is another lab that we use. It's a fantastic lab from a lab in Atlanta, Georgia, to really look at the overall immunology of the patient. It's estimated that around 80% of our immune system lies in our gut. So by looking at gut biosis, we can look into the patient's immune system at large. So these are just two of the many labs that we run to really give a comprehensive look, a comprehensive diagnosis into what's going on with the patient. We piece together all the pieces of the puzzle, because when you deal with just one piece of the puzzle, when you deal with just the routine labs that they run, it's frustrating. And people can go years and years and years in their life with nothing changing but their prescription list. Just more and more drugs over years and years. That's very frustrating when you're told your lot in life is just to live with this disease or just take this medication until you die. That's not the case that's happening with our patients here. So check out the website, check out the other videos on the YouTube channel to really see if this could be something that'd be right for you. Thanks so much.